Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich. Carlos Saracito is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. On Friday, the California Department of Public Health released the interim guidance for institutions of higher education. This is especially relevant for our county, as Santa Barbara County is home to the University of California, Santa Barbara City College, Allen Hancock College, and a number of prestigious private colleges. Tens of thousands of local students and residents study and work at these various educational institutions, and many students live in student housing or out in the community in shared housing arrangements. Higher education will be in session this fall, but will look much different this year than in past years because we need to work together to keep our campus communities safe and healthy. Since Santa Barbara County continues to be on the state of California's public health monitoring list, almost higher education learning will be done through distance learning programs with very limited exceptions for lab work that can only be done in person. In these limited cases, strict physical distancing and health precautions will be in place. The state public health guidance recommends colleges and universities with student housing prioritize the use of single occupancy rooms to the greatest extent possible. College and universities are also required to close non-essential communal areas such as indoor recreational spaces. The California Department of Public Health is urging colleges and universities to educate campus community members about their COVID-19 prevention plans, implement protocols for frequent symptoms checks of students and staff members, and establish steps that can be taken when a campus community member tests positive for COVID-19. UCSB, Santa Barbara City College, and Allen Hancock College have all announced their plans for remote learning. In addition to providing instruction virtually, our educational institutions are preparing to provide supportive services remotely. UCSB is instituting a wide variety of safety measures to prepare for a resumption of campus activities. Testing, surveillance, and contact tracing will be key components for managing the spread of COVID-19 on the UCSB campus this fall. The campus is putting in place a structure that will enable the testing of campus community members who show symptoms of COVID-19. Campus officials have also been working closely with the county's public health department to conduct contact tracing of campus community members who test positive for COVID-19. Allen Hancock College is working to ensure new and returning students will have the support, services, and technology they need to successfully navigate the fall semester that begins August 17th. This fall, Allen Hancock will continue to provide a wide array of student support services, both virtually and in person, to ensure students can continue to pursue their educational goals. Virtual student services include financial aid, tutoring, college admission, and academic counseling. For students unable to access student services online, in-person services are also available at the Santa Maria campus and the Lompoc Valley Center. To access in-person services, the college has asked students to contact the department they wish to visit ahead of time to make an appointment. To assist students struggling with technology and connectivity issues, the college will continue to operate its laptop and a Wi-Fi hotspot lending program. Registration for fall classes at Allen Hancock College is still open. The college is offering more than 1,100 classes across a wide range of academic and career programs of study. Santa Barbara City College announced the classes this fall will start fully online. Initial plans for the fall semester considered offering the majority of courses online with a small percentage of classes conducted face-to-face. The college had been working diligently on those plans for several months. However, since Santa Barbara County is on the state monitoring list, SBCC had to reassess its plans. Throughout the pandemic, Santa Barbara City College and the College Foundation have provided assistance to thousands of students in need, recognizing that students can only succeed educationally if their basic needs are met. The County of Santa Barbara will continue to work closely with our local institutions of higher education to collaborate on outreach strategies to keep students, staff, and faculty safe and healthy. During this pandemic, there are many uncertainties in the daily lives of young people, but our local educational institutions are working hard to help students realize their dreams. This week is National Health Center Week. It's an opportunity to highlight and celebrate the skilled, caring, and passionate healthcare provided through neighborhood and community health centers in communities across our country. Let's all take this moment to recognize and celebrate the important role community health centers play in providing high-quality, comprehensive health care services to underserved populations in our community. From the very beginning of the COVID-19 crisis, community health centers began finding innovative ways to provide preventive and primary care to their patients. Santa Barbara County is very fortunate to benefit from an outstanding array of community health care clinics that serve every part of Santa Barbara County from Guadalupe to Carpinteria. American Indian Health and Services, the Santa Barbara Neighborhood Clinics, and the community health centers of Central Coast care for thousands of local residents. In addition to these community organizations, the County of Santa Barbara operates 5 county healthcare centers in Carpinteria, Santa Barbara, Lompoc, and Santa Maria. County clinic healthcare staff have consistently gone above and beyond the call of duty to keep your community healthy. American Indian Health and Services provides quality medical, dental, pediatric, and behavioral health services to all members of our community. Founded in 1994 as a Santa Barbara-based nonprofit, their community clinic has served the Central Coast healthcare needs for over 20 years. Santa Barbara Neighborhood Clinics was formed in 1998 when 3 existing medical clinics that had provided care to low-income patients since the 1970s merged into one entity. All the clinics share a common belief in providing medical services for families regardless of their ability to pay in an environment that fosters respect, compassion, and dignity. Today, Santa Barbara Neighborhood Clinics consist of 4 medical clinics, 2 dental clinics, an integrated care clinic, a bridge clinic, and health promotion services. Santa Barbara Neighborhood Clinics provides care to over 22,000 unduplicated patients a year. Community health centers of the Central Coast began in 1978 as a small one-doctor clinic in Nipomo. They now have clinic sites spread all over San Luis Obispo County and northern Santa Barbara County. The short answer to who do they serve is the underserved, from farm workers in the Santa Maria Valley who have insurance, Medi-Cal, or no insurance at all, to retired folks on Medicare in Lompoc, Guadalupe, Los Alamos, or Cuyama. The longer answer to who do they serve is just about everyone, and no one is ever turned away from their inability to pay. Community health centers are lighting the way for healthier communities today and in the future, and we are very grateful for all of their community work during the pandemic. Jan Kogler, Disaster Preparedness Manager for the Emergency Medical Services in the Santa Barbara County Department of Public Health, is here to join us with information about testing. Ms. Kogler?
Thank you so much. Today I'd like to speak about 3 things. First, an update on our case numbers. Next, testing at our long-term care facilities in Santa Barbara County. And then the steps a business should take when an employee does test positive for COVID. First, it is with sadness that we are reporting 1 additional death related to COVID-19 in our county. This individual resided in the city of Santa Barbara, was over 70 years of age, and had underlying health conditions, and was associated with a congregate living facility. Our thoughts go out to their friends and their family. In addition, today we are reporting 78 new positive cases with a total number of 310 active cases in our county. Of the new positive cases, I can tell you where they were located. 13 were in the city of Santa Barbara, 1 in the city of Goleta, 2 in the community of Isla Vista, 2 in the unincorporated area of the Goleta Valley and Gaviota, 5 in the city of Lompoc, 45 in the city of Santa Maria, 3 in the community of Orcutt, 4 in the North County unincorporated area, and 3 are pending their geographic distribution for a total of the 78 cases. As you may know or may have heard, the state data reporting system known as CalReady has been experiencing delays, and that's resulted in lower number of positive and negative results distributed out to counties. We do expect additional cases to appear in the system in the coming days, and we'll continue to report them as we receive them. We do hope to have more information and more data by next week, and we don't currently know the magnitude or the timing of when the cases will come in or how this might affect our testing positivity rate, but we did want to know, to expect those results to be coming in. So next I want to share an update on the process of testing, which is taking place at our long-term care facilities when an outbreak has been determined. And these facilities include congregate living facilities, residential care, skilled nursing facilities, what you might know as assisted living, and others. We currently work on approximately 25 facilities per week that are implementing widespread testing in response to positive cases. And this means if one or more cases occurs in staff or residents at one of these licensed facilities, the facility then must conduct testing of all the staff and residents. And as you can understand, this might mean very large numbers of tests taking place. The Public Health Department monitors the results. We support the facilities every week to get the testing done. This week, the department is supporting 11 facilities with either the Medical Reserve Corps volunteers or AMR to provide the swabbing and coordination of the testing. And so widespread testing is done at these facilities to identify new cases and control disease spread. Facilities implement specific use of PPE when they have positive cases, in addition to the regular enhanced PPE when they do not have the cases, and specific infection control when there are positive cases. And the health department continues to provide guidance and PPE to facilities daily to assure that they can maintain the procedures they need. I want to give thanks to Direct Relief that continues to provide us with storage, receiving, and staging for the shipments, the receiving of supplies from the California Department of Public Health. So many thanks to Direct Relief for their help to us for that. The final item is, as COVID has sort of settled into our community, more businesses are encountering the situation of having an employee test positive, and they're asking us, what do I need to do when this happens? What steps should I take? And employers play a large role in preventing disease spread, both in their workplace and also in our community. So we really thank them for the work that they're doing. So the first thing to note that is employees should tell their employer if they test positive or if someone in their household has tested positive, because then they are a household contact. And the employer should, of course, first instruct the employee to isolate at home, or if they're a household contact, to quarantine at home, to stay home if they have a household contact, and not come to work. And of course, make sure that the employer knows how to get to a medical provider if the symptoms are anything but mild. We want to make sure that folks are hooked up with a provider for that and they get the care they need. Next, you want to determine the last day the employee worked or was on site, and then make a list of your employees, contractors, and others who may have been in close contact with the person, because those are what it's called a close contact. So you might ask, what is a close contact? And that's someone who is within 6 feet of someone for more than 15 minutes, so with an infectious person. So 6 feet for 15 minutes, 2 days before they had symptoms or 2 days before they got tested until they're not infectious anymore, and that's usually about 10 days after they develop symptoms or 10 days after they got tested. So if you determine that your employees were in close contact with that infectious person, they need to be instructed to quarantine at home for 14 days and hopefully get tested, hopefully access testing. However, even if they get tested, say on day 5 or 6 and they're negative, they still need to quarantine at home because they could become sick anytime during those 14 days. Be careful when notifying employees who are identified as close contacts that you keep confidentiality. You're not supposed to reveal the name of the employee that you know tested positive while telling folks that they may have been in contact with someone and that they need to quarantine. In specific cases, for essential businesses, if you have employees that perform critical functions, that's going to prevent the business from continuing, those folks may be able to continue to work, even if they're close contacts, with some care, some extra steps provided. So if you're in that situation, please consult with the health department to determine the methods to allow this to safely continue. And then the other question we always get is, when can my employee return to work? And so if the employee has symptoms, they need to wait for at least 10 days. And the last 24 hours, they need to be fever-free and virtually symptom-free, or symptoms greatly resolving, with no use of Tylenol or anything else to bring the temperature down. And if you're asymptomatic, which is quite a few people, it's 10 days from the day you were tested that you can go back to work. Finally, remember that COVID presents with many, many different symptoms. We now know this. Remind all your employees to stay home with any illness symptoms. And we know it sounds like, well, maybe they're really not that sick. But in these days, a sore throat, a cough and cold, gastrointestinal symptoms also present commonly, headache, loss of taste or smell. These can all be symptoms of COVID, and even though they're mild, so best to stay home. The health department does not require employees to get retested before they go back to work. A lot of questions about that too. We don't generally issue letters that allows the person to return to work, but if they meet all those symptom criteria and it's been at least 10 days, and for some people it's going to be longer, they are allowed to go back to work. Additional information on what business can do or should do an employee test positive is available on our website. Also instructions for people isolating or quarantining at home on the public health website at publichealthsbc.org. So thank you very much, and I'll turn it back over to you.
Thank you, Ms. Cochran. As I mentioned in my introductory remarks, this week is National Health Center Week. Dr. Charles Fqhc, the CEO and Chief Medical Officer of the Santa Barbara Neighborhood Clinics, is here today to share his insights in the work the neighborhood clinics have done to address COVID-19 in their work in the community. Welcome, Dr. Fqhc.
Supervisor Hart, thank you very much for having me. I really very much appreciate that. Well, sometimes some people ask, what is an Fqhc? What is a federally qualified health center? So I thought it might be helpful if I just gave a little bit of background on that. This is a safety net system which was started way back in 1991 under the Healthcare Coalition Act, which is Section 330. There's a quiz at the end of this. Just keep your attention to me. Of the Public Health Service Act. The idea was to have a safety net that could take care of folks in the community that didn't have access to any other source of medical care. And so the system was set up to have an enhanced payment system through Medicaid and Medicare. So we are not allowed by law to turn anybody away for, as you mentioned, for inability to pay. So that's one. We're also governed by a consumer board. What that means is that 51% of our board has to be made up of people who use our clinics. And the idea there was to not have any old boy clinics, even though some of us are old boys. Lastly, this prospective payment system that we have, it's called the PPS system. I refer to it as the perverse payment system, because it's based on cost. So for those of us that used to run businesses, no other business is based on cost, right? It's your revenue, and from that you pay your costs, and then whatever you have left over, you take home. So this is a different system, but the idea there is to cover folks who don't have access any other way. So I thought I might just give you a few statistics comparing the program nationally with our program. So currently, there are 1,385 health qualified, federally qualified health centers in the country. That makes up about 17,000 clinic sites. We have 8, for instance, as Supervisor Hart mentioned. The number of patients nationally, 29,836,613 are cared for by a health center. We're taking care of about 22,000 people in Santa Barbara. Nationally, 91% of the folks live at 200% or below the poverty level. Our figures are about 76% below the poverty level, but that doesn't include the 31% who have no insurance. And those folks pay us through what's known as a sliding fee schedule. So we have a 4-tiered sliding fee schedule. The bottom tier, level A, is $42 all in, meaning whatever we do during that time that we're with them, medicines that we provide, IVs that we start, EKGs that we do, are all covered in that $42. And then we have payment systems for people that cannot afford that at the time. So we have some folks that are paying us $5 a month. And then at the end of a certain period of time, we write it off. We're supposed to keep that secret. I realize that this is a televised program, so don't tell anybody. 51% of our patients are covered by Medi-Cal, 3.4% by Medicare. The Medi-Cal number includes people who are covered are so-called Medi-Medi, Medi-Cal, and Medicare. Private insurance, we have about 12.45%, and no insurance, I mentioned, 31%, which is quite a bit higher than the state average. The state average is about 9%. And I haven't quite figured that out, but that's the cost per visit at our clinic. It's about $206 per visit. The revenue on average that we get from our visits is about $125. So as you can see, there's this giant gap, and we depend on the largesse of the community to help us with that great big gap. The services we provide include primary medical care. I'm a family doc by training. I did deliver babies for much of my career, which was a wonderful experience because there's only one way that people come into a hospital that really enjoy the experience, and that's if they're coming in to have a baby. We provide dental care. Every single one of our clinics has a behavioral health specialist, and we do warm handoffs. So if I see somebody who really appears to need to have a consultation with one of our therapists, I can just walk next door and say, Daisy, would you mind helping me with this particular problem? And that really expands the access to mental health services. We have a chiropractor, I'm happy to say. So does CHC. In fact, it's the same chiropractor. We have enabling services. So what does that mean? Enabling services are services that allow the patient to be able to, they're non-medical services that allow the patient to be able to manage their illness. So, for instance, our wellness navigators are people from the community that are trained to understand all the resources available in the community: housing, transportation, legal aid, etc. And so if somebody is in need of these services in order to manage their disease, then, and today when I was seeing patients, I set 2 people right next door to get hooked up for housing. We have a care management, a nurse care manager program. We now have 2 RNs that are doing that. These are folks that will take on anybody who has additional difficulty managing their disease, people with very brittle diabetes, for instance, people with mental health issues that struggle to navigate the system. Our nurse will manage those folks. She takes on a load of patients. She'll go to their house and organize their medications. She calls them every day to see how they're doing. What was your blood sugar this morning? To see how that goes. And then we have a health education department. So let me just finish by telling you what we did for COVID. We did very, very early on after the lockdown, we were up and running with telehealth. And so we offered, we didn't close our doors to anybody, but we offered virtual visits to people that were really afraid to come in. The first 2 weeks after the lockdown, our encounters just took a nose plunge, just like everybody else's did. But then we were back up and running with virtual visit opportunities. So we also rearranged our schedules so that our clinics get cleaned in the evening. And so in the morning, we would see patients that did not have any symptoms consistent with COVID, so that well people with diabetes, hypertension, et cetera, could be seen in a safe environment. We screen everybody at the door with a temperature and a list of questions that were developed with Jan's guidance by a number of us in the community to decide whether or not the symptoms occur that are consistent with with COVID. And then when they come in, we've separated all the chairs in the reception area by 6 feet. So if there's not enough room for you, then you wait in your car till there is, and then somebody will come get you. Once you're in, once you get to the parking lot, where everybody's expected to wear a mask. All of our staff wears a mask. We wash our hands before and after every patient. I tell our staff to, every time you walk past one of those dispensers, just take a squirt so that we stay. So we've been very, very fortunate with that. And I'll talk about that in just a second. And then at the end of the day, people who have symptoms consistent with COVID are seen. And they're seen in their cars to start with. So we have a person who's all decked out in their PPE. And again, thanks to Direct Relief and to the county for helping us stay well stocked with PPE. So that person will then meet with the patient in the car and do the interview, do a short exam if necessary, and do the testing as indicated. Patients who are not bad sick will be told the same thing that Jan just talked about. You go home and you quarantine until we get the test results back. People who, we also carry with us a O2 saturation monitor, so that if somebody seems to be quite ill, then we'll make sure that they're oxygenating well. If not, then we will arrange for them to be seen in the hospital, either by ambulance from our site or by a private vehicle. So we've been very fortunate in that we've only had 5 of our staff become sick from this illness. And 4 of those 5 were infected by the same person who came in for a interview before she knew she was sick. She got bad sick about 2 days later, had tested a day before she came in for her interview, and called us 3 days after and said, I'm in the hospital because I'm so sick. And these 4 individuals we tested them, and 2 of them became pretty sick. And then the 5th person was at a barbecue, we think. So we've been very, very fortunate because everybody's doing the right thing. I tell our staff, you're safer at work than you are anywhere in the community, just based on our numbers. So thank you.
Well, thank you, Dr. Fqhc, and thank you to everyone on the Santa Barbara Neighborhood Clinics team for all the extraordinary work they're doing in this moment.
Thank you.
Next, we'll go to questions from the room. Ms. Lair?
Thank you so much. Jan, could you talk about contact tracing? I'm hearing that in other states and even other California counties, people don't want to cooperate with the people you've hired to call on those contact tracing calls.
Well, what I know is that, we are doing contact tracing, and at times, people do not answer their phone, and we continue to try to contact them. And then sometimes people do not want to give up the names of their household contacts or other contacts. It does happen. But we have to try, and we get, pretty good results. But there are some folks who really, they're worried. Maybe they worried that they don't want to be excluded from work. There are some fears about that, and so that does happen from time to time. So I think that's probably what you're hearing from other states as well.
And I think, let me just add too, that this is a great example of the importance of the privacy of personal medical information, that there's a tension sometimes in the community's interest in knowing more about the individual cases that we describe and report here to the public. And the reason for that tension is because it's really important, and it's a very high value for the county, and it's the law to protect the privacy of people's individual medical information. And so that is something that gets in the way sometimes about releasing information, and in the contact tracing business, finding out information from people. But this is an extremely important part of the system that encourages people to participate voluntarily and give information to the public health authorities that we can use to action in the community. And it's something I think that isn't necessarily fully understood by the public, but it is important to know that it's not only the law, but it's an important tool in the ability for us to respond. So I just wanted to interject that. Thank you.
And Dr. Fqhc, in your telehealth or with your mix of clients, are you hearing that they're getting a mixed message? Do some of them think this isn't going to impact them?
That's a really, really good question. That was particularly true at the beginning of the pandemic, when it looked like only people my age got sick. Suddenly, and so we saw a lot of folks who thought, well, I'm fine. So I'm not wearing a mask. I don't need to be protected. So then we started with the message, it's not me protecting myself, it's me protecting you. And you're wearing a mask so that you can protect me. Please do. And so that's been an uphill battle, and as you well know, as you walk around town, you see people who are still struggling a little bit with the mask idea. It's getting much better, I have to tell you that. I think the message is getting out. The contact tracing issue is also a really tough problem because of this whole worry about, several things. One is your immigration status, or the immigration status is somebody you love. So this is maybe not the right venue to share this, but what we're noticing is that we've had a drop-off in the number of people on Medi-Cal. And the reason for that is these are people who qualify for Medi-Cal, but because of this public charge issue, they are afraid that they're going to get their loved one in trouble who does not have documentation papers by being on Medi-Cal. And so they will give up their Medi-Cal. And so that's a really tough issue. And what we're trying to do now is figure out a way to get hold of those folks, but also to get hold of the folks that we also care for. The 31% are folks who don't qualify for Medi-Cal. And there's really only one way that you don't qualify for Medi-Cal, and that's by not having your documentation papers. So we want to be able to get the message out to those folks too. Listen, you're part of our community. You need health care. We need to deal with your diabetes, your hypertension, et cetera. Oh, I am so sorry.
Thank you.
Next, we'll go to questions on the phone.
Yes, we've got several. Our first up is Nick Welsh from Santa Barbara Independent. Nick, go
Hello,
ahead.
thank you guys very much. I have a couple of questions here. First one, I want to sort of go to the pressure point that Greg highlighted. I think this question though probably is better for Jan Kozler. I'd like to hear what you can tell me about what's happening at Also Lucero. It is a senior care facility on the South Coast. 39 residents there are infected, 21 employees are infected. I don't know how many deaths. I think it's 4 or 5 at this point, if you would clarify. And I'm trying to get a picture of, this is the biggest hotspot on the South Coast. How is the contact tracing going? What kind of quarantine housing can you provide the employees there? And what I'm told is a lot of those employees at Also Lucero happen to work at other senior care facilities. And so what steps can you describe how that is being circumvented and reined in?
Well, thank you, Nick. First of all, I'd like to say that the Public Health Department does provide isolation and quarantine facilities, specifically hotel rooms for persons who can't safely isolate or quarantine at home. So certainly those are available to any of the skilled nursing, assisted living staff that are quarantined or isolated. So if any of them are positive, they are what we call isolated. They're taken off of work for that time. They are, all these facilities, as I mentioned earlier, have rigorous testing protocols. So weekly, every week, every single person, contractor associated with these facilities and all the residents are tested so that we can identify, they can identify any positive cases and isolate them and take the necessary measures. CDPH licensing is also involved, and we have weekly conversations with them, and they are on site at least weekly, if not more often, at all of the skilled nursing facilities and other assisted living facilities that are experiencing those outbreaks that you're referencing. I'm not allowed to specifically, I don't provide information on any specific facility, but as you know, and as you're referencing some numbers, you can go on the state website and our website, and we do list the number of cases at each facility that is a skilled nursing facility at least. So I hope that helps to provide you. We want to support those workers. Very important that the folks in the care homes continue to get the care needed, and so we work very closely with the facility to make sure that there are enough workers, that they're contracting with outside agencies if necessary. The state also steps in and provides assistance as well. So I know we're all very concerned, and we're focusing a lot of energy on those facilities with those larger outbreaks as well.
Can you explain why you're not at liberty to divulge the number of deaths at that specific facility?
That's just not something that we do. We don't right now call out that. You can find some of the specific information on the state website. And so I would look there specifically.
No, it says less than 11, but I think it's 4 or 5, but it does seem, for the South Coast, it's a significant hotspot, and I would hope that your department, County Public Health, would be able to be more forthcoming than the state statistics.
Well, I also want to point out the way the deaths are reported are sometimes not exactly timely, so whatever you see today may not be reflective of what is happening over the last 2 weeks. It does take a
Right.
while for the death certificates to be reported. So on the state website, you'll see it says less than 11. If you get over 11, then it does start to report the specific numbers. So I'm sorry, I have my mask on. It may make it harder for you to understand what I'm saying.
No, I can hear you. Thank you.
You can hear me fine, okay. Okay, so it's just that, what we do to continue to work with the facility to try and find the best outcomes we can, also balance that with providing the information that people want to know whether they should be more concerned or not. And that, I think that the state website does provide that sort of level, less than 11, more than 11, you will start to see those numbers and you'll know exactly what the numbers are there. So I appreciate your concern and your looking into these things.
Oh, thank you. One last question on a different subject. Probably as we speak or later today, the Santa Barbara City Council is going to be voting to open up the central business district so that right now all the businesses have to shut down at 10. They're going to open it up to 12:30. They're going to do the same for the Funk Zone, and they're going to do the same for the Coast Village Road businesses. And that seems like a fairly substantial expansion. There was a reference made throughout the council deliberations about more enforcement. And I'm wondering if you guys can explain what kind of conversations, discussions, plans were hatched in advance about that enforcement. Is this a hope and a prayer, a pig in a poke, or is there some actual plans and thought that actually took place and said, this is what we're going to do, we're expanding the hours? Obviously, this is 10 o'clock to 12:30, people are drinking more, they're getting a little bit looser. Could you outline what kind of planning took place, collaboration took place with County Public Health on that?
Well, I'll just say that the county staff at the the County Department of Public Health have been meeting regularly with representatives from all the local governments in the county to discuss enforcement strategies and ways to collaborate to have the most impact in that space. I don't know specifically what the discussion was about this particular item, and I'm not going to prejudge the decision of the City Council today, but we are all trying to get on the same page in regards to enforcement and enforcement tools so that we can have the maximum impact on behavior in the least intrusive way. We're continuing to encourage people to take personal responsibility and make the right decisions in instances like that. There are ways to mitigate risk and get control of situations that could be potential opportunities to spread the virus. And we'd hope that every business and every individual in the county takes the message, the consistent message that we continue to share about personal hygiene, mask wearing, physical distancing seriously, because all of our collective ability to make a living, to have a functioning economy, And to keep people employed depends on us being successful in controlling the virus.
Thank you. Next up, we've got Tom Bolton with News Hawk.
Good afternoon. My first questions are for Ms. Kogler. First of all, I didn't hear any hospitalization or ICU numbers today. Do you have those?
I do. I'm sorry, I neglected to give those to you. I was just looking at that. So we currently reported 76 is hospitalized, with 31 of those in the ICU.
Okay, thank you. My second question is also for you, and it pertains to testing. You talked about testing in the congregate care facilities, but can you give us an update on testing in the community? Has it expanded at all beyond the parameters that had been outlined a few weeks ago? What are the wait times for appointments like? What are the wait times for results like? Because it seems like testing is really crucial to all the other things you're talking about, especially contract tracing.
Yeah, absolutely. It's all about the testing. The 3 community sites that you're familiar with, the Santa Maria Fair Park, the site in Buellton in the AMR classroom there, and then at Earl Warren, they did switch to a different laboratory provider called Let's Get Checked, and we are hoping that that results in quicker turnaround time. I don't have the exact turnaround time yet. We've heard of some better turnaround time, so we're hopeful. And the backlog in getting an appointment has changed, and I believe that's much quicker. It's about a week, and occasionally there are walk-ins that are allowed for special priority groups. But because we were having some challenges getting priority contacts tested, the health department has set up some specific testing days for priority groups where we provide the testing. So just to get those contacts that we need to get in tested in specific priority groups, instead of asking them to funnel through those community testing sites all the time. In some cases, we will be doing those ourselves. So we get that turnaround, that test that we need more quickly. So we're hoping with a combination of those 2 things, we can get some better results. And again, as I mentioned, there's about 25 facilities a week that are doing this widespread testing of all staff and residents. Those are the residential care sites every week. So there is a lot of testing, and that's a lot of staff and community members getting tested there as well.
Do you all actually know how many people get tested on any given day? I mean, we know how many results come back, but do you actually know how many people get tested yesterday or today or whatever day?
Well, we know how many results come back. We don't know how many people necessarily are tested through the various physicians' offices or all the Cottage Hospital sites or Marion, Lompoc, et cetera. We do know how many people are tested at the community testing sites every day. It's probably got a day or so delay, but we can see the numbers coming through. So at another time, I don't have that actual total amount here, but we can tell you the total number of individuals. Actually, let's see. What I have here is the total number that we know of, and this is probably since we began in March, is 90,000 tests conducted. There are others that we don't know about, but these are the ones we do know about. And of those 90,000, we have around 7,074 that are positive, 82,000 around that are negative, and inconclusive for 250. So that gives you at least some idea. But it's not everything, so I don't want to steer you the wrong way there. There's more than
No, and I appreciate that, and it's just that we know how many tests come back, but the numbers vary widely from a few hundred to more than a couple of thousand on any given day. But it'd be interesting to know on a consistent basis how many people are actually getting tested. So it doesn't sound like you have that right now, but just for your consideration. My last question is for Dr. Fqhc. Just following up on Tracy's question, I'm wondering, when you look at your patient population, first of all, how well do you think they understand what you believe is necessary to minimize the COVID spread, and how well do you think they are embracing those I guess I'll say requirements?
I didn't catch the word about which population to which you're referring. Did you say the youth?
Your patient population.
Oh, my patient population.
You tend to see a lot of lower income people,
Yeah.
a lot of people on Medi-Cal, et cetera. I'm just wondering, in that patient population, do you feel they, first of all, understand what is being asked in terms of social distancing and masks, et cetera? And secondly, if they do understand it, how well are they embracing it?
I think that's a very complicated question to answer, but it's a very good question. So let me make an attempt to do that. The folks, many of the folks that we take care of that are at the very lower end of the socioeconomic scale, let me preface by saying we take care of a lot of people who are, middle class income folks, and they're doing fairly well. The folks who are who are part of the essential workforce, I think are getting the message very clearly. The problem is that they are at high risk because they're in jobs where they're very close to other people, agriculture particularly, and also because they're in living situations that put them at high risk. I have a couple of patients who have two families in an apartment. It's almost impossible to social distance in that kind of a situation, which is why our patients are in that who are in that situation in terms of symptoms for COVID are delighted to have the opportunity that the county is offering to quarantine at one of the sites that they have offered. But I think the message is coming across. I think the problem really was young people. I think young people had the idea that they weren't going to get it. And I think that was one of the big issues that I think the older folks we take care of have been worried from the get-go. And that's one of the reasons we weren't able to see them. I'm not going to come in there and see, you guys where all this illness is. So we've spent a lot of time talking to people about how safe it is to come into our facility. And we're putting together messaging that specifically talks to that. The message that I mentioned a minute ago, that you're probably safer inside our clinic than you are in the community, based on our numbers, is what the message that we're trying to get out to our patient population.
Thank you, Tom. And next up, we are going to Fabiola Navarrete with Tu Tiempo. Fabiola, could you unmute?
Yes, I'm here.
Thank you. Go ahead.
Okay, thank you. Well, my first question, it was already answered. So just to ask you again, so are we expecting some reducing in the time for the results and also to get an appointment for the test?
Yes, that was the idea with moving over to the it's called Let's Get Checked is the new laboratory provider to all the state contracted sites. And the idea is to get the test sooner. So we have heard of people getting the test results back within a couple of days, but I don't have a large enough sample to know that that's happening at all times. And we had sort of a transition over. So hopefully by next week, we'll be able to see they're getting those results more timely, because getting your results, as we all know, when after you're all done isn't super helpful. But the time to get an appointment is also less now. So we're hopeful this is going to be better for the community, the new testing strategy at those sites.
Okay, thank you. And my next question is referring to the PPE, because you just said that you have been providing, and especially for the testing facilities, you're gonna have plenty of them. But we've heard many complaints from healthcare workers about this. So, have you been providing enough PPE for the hospitals and people who has been working all this time, in the hospitals?
The supply of PPE has varied from the beginning, and there's been shortages of different things. We had a shortage of gowns for a while. Now we're looking pretty good there. We had plenty of N95s for a while. Now we have the N95s, but it's not the model that everybody wants. But if you know of a healthcare provider, a hospital that does not have enough PPE, they should contact us. I think that most of the providers do know. We have a specific way they can request PPE, and now we may not have enough for everybody to have be able to throw away the N95 that they use every day. So we still have some conservation tactics around those N95s, how to keep them so you can use it, 3 or 4 days later and so forth. But there should be enough to keep people safe. And certainly when there's an outbreak, we reach out to facilities. Those are residential facilities. It might be different than what you're thinking of. And we ask them, do you have enough PPE? We don't want you to be in the situation right now where you don't. And so we do what we need to do. So just have them contact us, though, if there's any question.
Okay, thank you so much. That's all. Thank you.
Thank you, Fabiola. And last up, we're going to Brooke Holland with News Hawk.
Hi, thank you. My question is kind of similar in regards to the PPE. On the county's reopening metrics website, under the PPE and protective gear metric, the latest hospital survey is listed as July 22nd. I was wondering how often facilities take the survey on each type of PPE and how often that metric gets updated on the website.
I believe they should be filling out a survey every day. They report to the state on their COVID cases, their COVID suspect cases, their capacity in their ICU, et cetera, and also on their supply of PPE. They recently changed how they report it, so I'm not getting that automatically as an Excel sheet. So I haven't seen it for a couple of days, but it should be, we are familiar, and we talk to them every week, several times, to find out, how they're doing with their PPE. So we could potentially update that on the website.
Okay, thanks.
Thank you, Brooke, and that ends our questions.
Thank you for those questions. Our next press conference will be Friday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today.